Medical professionals from around the state gathered this week to hear world-renowned Professor Guntram Schernthaner's musings on type 2 diabetes. The event mainly focused on the benefits and drawbacks of insulin treatment and its effectiveness on treating diabetes, and was hosted by Eli Lilly, the 10th largest pharmaceutical company in the world. Reporter Badriya Saleh has more on this story.
9 round tables and 54 plush seats adorned this private event, as one by one medical doctors filled the room and vigorously started taking notes. The room full of physicians convened to hear another perspective on type 2 diabetes. Kuwait Diabetes Society and pharmaceutical company Eli Lilly co-hosted the event, inviting doctors from around the country to come and hear Dr. Guntram Schernthaner share his expertise on insulin treatment.
I'm hoping that the doctors will understand why premixed insulin preparations are very helpful. So there are several mixtures available with different concentrations of short-acting and long-acting insulin, and with this type of premixed insulin you can individualize treatment according to the individual need of the patient. It's important to understand that many patients need insulin, not from the beginning. At the beginning they should lose weight, they should have more exercise, but later on, with the progression of beta cell dysfunction, many patients will need insulin. Then you have several options, and it's the best to control both the fasting as well as the postprandial glucose levels, and this can only be done by basal bolus treatment, which is very difficult to adapt to elderly patients, or by the much more simpler use of premixed insulin preparations.
Dr. Schernthaner is a professor of medicine at the University of Vienna and president of the 32nd annual meeting of the European Association of the Study of Diabetes. His lecture reiterated that insulin on its own isn't efficient enough. Forming an individualized therapy plan with a medical professional and following that plan is the most effective way of living a healthy life with diabetes.
I was particularly interested to find out what the other doctors here felt was what is the practice in the Middle East, because it's different in different countries. Okay. What I learned is that there are lots of different ways of treating type 2 diabetes. Published data suggesting that basal bolus insulin is superior to biphasic insulin. The problem is trying to convince patients of this. Patients don't like having frequent injections.
Local doctors that attended the event were quite engaged with the presentation and expressed the importance of being informed and current on treatment methods as a physician.
As the event wrapped up, the doctors collected their pile of notes, eager to take what they learned to share with their coworkers and patients. At the Regency Hotel, I'm Badriya Saleh for the English News.